Our second case this morning is also a rhinoplasty, but in this situation it's actually a secondary rhinoplasty. It's a rather unfortunate story that we hear all too often of a young woman, only 18, who travelled to South Korea to have her rhinoplasty operation. And I know that there are many excellent surgeons in South Korea, but there are just so many surgeons there that unfortunately it's very easy to end up with a surgeon perhaps who's not as experienced, who perhaps doesn't have the same judgment with Western noses as they may have with Oriental noses. And this is the situation that occurred here. So the young woman established contact with a clinic in South Korea and went to have a rhinoplasty. Essentially she wanted a smaller nose and with a slightly turned up tip. And what she ended up with was the scar across her columella from an open rhinoplasty procedure which was performed, and then, if anything, a slightly fuller tip than before. So very little change to her nose except for the scar that she now bears across her nasal columella. So I have done computer imaging for her and I've determined by this method what changes she wants to her nose, and my plan is to remove some of her bony hump, remove some of her cartilage, and narrow her nose and give her a much slimmer, more aquiline, and more attractive nose for her face. So I think they're just putting her to sleep in theatre now, so let's go along and see how we go.
So here we are in the operating theatre, and you can see that even though she's had a rhinoplasty in South Korea through an incision across here, the scar has healed fairly well, but really she's still been left with a little bit of a bump on her nose and quite a broad nasal tip and quite large alar bases. So even though she's had a previous open rhinoplasty, I'm going to do this by the endonasal or closed approach, making little incisions inside here, removing the bone that's causing the hump, removing some cartilage here from the tip, and possibly also at the end we'll remove a little bit of tissue from the base here just to make her nose a little bit smaller and to give her that slim aquiline nose that she would like. So here we are at the end of the procedure, and we've reduced the dorsal bump of bone that she had. It was a difficult procedure. There was a lot of scarring in the tip, but we've taken out a lot of cartilage in the tip. And also there are 3 little stitches here where we've taken out some tissue to make what we call the alar base a bit slimmer. So her nose is a little bit swollen now, a little more difficult than a primary rhinoplasty, but still through the endonasal or closed approach we were able to reduce this nose that had previously had an inadequate open rhinoplasty.